I was born and raised here in Indiana. I'm married to my beautiful wife, Tori.
I met Eric about 21 years ago. We've been married for 15 this summer.
We have 3 children. We actually live in the woods just right outside of town. One thing that we love doing in the fall and springtime is hunting. When we go hunting, my grandpa and I, we would sit there just watching the sun come up every morning. It just kind of reminds me that no matter what kind of craziness that we faced the day before, you know, today's a new day and it's something else to look forward to. My name is Eric Osborne and I've been diagnosed with chronic lower back pain.
So intractable mechanical chronic low back pain, I think intuitively, most of us understand what that is or can relate to what that is. That's for ourselves or for someone we know, someone who has what we would describe as a very, very bad back. Someone who says, listen, my back is killing me all the time. Neuropathic or radicular pain, that's a nerve pain, as opposed to mechanical or nociceptive chronic low back pain, which is just pain where the back itself is hurting. In terms of low back pain, the nociceptive pain is significantly more common than neuropathic.
So in 2007, I was deployed to Iraq. We did a lot of building projects and we also provided security to our teams. I didn't have the back pain then, but within just a few years after my deployment is when things really started showing themselves.
After he came home from Iraq, started with his feet bothering him and then ended up with his back bothering him.
I noticed that I would start having numbness in my right foot. The numbness always continued up until my back pain really started to take effects on me.
When he experiences his feet going numb, that patient is likely experiencing some nerve compression. So when somebody has a painful condition in their spine, in those cases, that can then cause really a vicious cycle where there's pain, there's muscle inhibition, there's some loss of stability, and that instability is going to drive more pain.
My back pain got so intense a lot of times that it would just hit me so hard that I would lose all control of my legs and fall down.
When his back would go out, it was concerning. I worked a second shift for a call center. He would be giving one of the kids a bath and his back would just go out. So there was times where I'd have to come home and help him.
The worst one was just about 4 years ago. We had one of those rollaway dumpsters outside. And I went to go lift the handle up on the back of the dumpster. And all I remember was laying on the ground, hollering for my boy to come in and get my phone out of my pocket so I could call for help. After my spells, I had to be very careful how I lifted, especially the littlest ones, because any little wrong turn or twist, you could have been laying there right there beside him. She did not kiss me. It felt like that was my new norm. I didn't know what the next day looked like. I didn't know whether or not I was going to be able to go to work.
In some individuals, we do think that what's happening is there's pain from a structure, such as one of the intervertebral discs or one of the joints on the spine, the facet joints. And in response to that pain, the multifidus muscle, which is the strongest stabilizing muscle of the spine, stops firing. That inhibition of the multifidus then is creating an instability and a cycle of worsening pain and causing the pain to be refractory.
When you don't have that back pain, I think it's hard to understand it. I know I didn't at first, but watching him, you can tell how hard it is on someone. But I could see, bosses, employers, supervisors probably got annoyed. My back hurts, I can't come to work. They probably think it's an excuse.
I was working at a crankshaft company. I remember that I had wanted to do one movement and it basically took me completely off my feet.
He was pushing and pulling 400-pound crankshafts and he could not do it, and he lost that job because of it.
I'd went through several jobs trying to find something that I could push through, and it just seemed like everything I tried always failed, which then, it just Emotionally, it just wrecked me. And it was shortly after that was when I started seeking more medical help.
The most common reason why patients are coming to see us is, quite frankly, just severe chronic low back pain. I need some relief from this pain. I need to be able to do the things that I do for a living. I need to be able to do the activities that I do with my family.
He started with the chiropractor. We thought that would help.
It actually made it worse. I just couldn't hardly even get up off the table, and days after I was still hurting. I did try different types of medications for pain management, but it just never actually helped solve the problem. It would kind of knock the edge off, but it would never take it away from me.
One of the challenges with treating back pain is that we're treating both the nervous system, the spinal cord, the spinal nerves, as well as soft tissues, the bone, the ligaments, surrounding muscles, and taking all of that into account.
Here we go.
In some instances, it's tricky even to figure out exactly what's generating that pain. So for many cases of chronic low back pain, it's going to start out with simple medications, non-steroidal anti-inflammatories, perhaps muscle relaxants, and likely physical therapy and/or a home exercise program. Physicians will then look at some injections. In very advanced cases, we will also look to see is there something that should be addressed with a surgery. And finally, in other advanced cases, we will sometimes consider things like an implantable stimulator.
So after extensive scans and MRIs, the doctors found my L2 and 3, they were compressed, and I lost the fluid in between those discs, and I also had bulges on my 4 and 5. So whenever I would move wrong, those bulges would hit my sciatic nerve, and it would just put me in a whirlwind of pain. They told me that there was no surgery at the time that they could do to fix my problem, because it was just going to be creating bigger problems later down the road. So instead, we started doing spinal injections, and I would get one once a year and sometimes twice a year, and I did that for over 10 years. The treatments, they did help for a small amount of time, but it would be within 8 to 10 months, and I would be back almost to square one again, and I'd be scheduling another appointment for another epidural shot.
It was very frustrating. Every time we thought, he was better, the back pain would come back. It's hard to see the person you love in pain, but there was only so much, that we could do.
So some patients have findings based on their pain, their physical exam findings, and their imaging, where it's really clear that a surgery has a very high likelihood of giving them an excellent outcome. So as a non-operative spine specialist, when I'm treating a patient like that, I'm going to quickly get that patient to one of my excellent colleagues in surgery. There are other patients who have severe pain, but when you look over their whole case and look at their imaging, there isn't something that's clear for the surgeons to fix with an operation. The challenge is, what can we do for the patient who, on the one hand, does not have an indication for surgery and who haven't recovered with physical therapy, medications, simple injections?
I went back to my doctor and said, we have to do something because I can't do this. This is too much of a struggle. But there was a study that was going on that she was able to get me into.
It was the first time we had gotten an option, something that could possibly take care of this.
So restorative neurostimulation to treat chronic low back pain is a new therapy. It's a novel therapy. It's something that we've done a lot of research on.
I started feeling better. And I remember asking my wife, I said, do you think that I should do this? Because it was an experimental thing.
This is a big step for a patient. With any mechanical device, there's always going to be some risk.
I was nervous. He was having a surgery that we were choosing to have, but we also knew that this wasn't his story. There was something better out there for him.
So the back stimulator was the beginning of my recovery story. And after just a few months, most of my pain had disappeared. After I got back from Iraq, I kind of got lazy a little bit, and I did gain a lot of weight. The weight contributed to my back problems. I was very fortunate enough to have some good friends that are health coaches.
So I helped Eric with a holistic transformation program.
So I started the program in February, I believe, and by the end of April, I had lost close to 60 pounds. What pains I still had left after my surgery had disappeared, and it allowed me to have a sense of freedom that I have never felt before.
Losing the 60 pounds, getting his nutrition on point, eating an anti-inflammatory diet, and then getting that emotional health in check really was instrumental in helping him.
Yep. I did have a lot more energy build up than I've ever experienced in the past. And one night I was walking out of work and I really felt like I just needed to run. So I started doing small runs.
I was not happy when he wanted to start running. I told him, you know, you just got to where you aren't in pain. Why would you want to do this? But the more he does it and the more active he is, the better he feels, and yeah, the happier he is.
Running has just been something that's been able to help me just kind of free my mind, to be able to relax, to be able to think about my day. My passion is just to let people know not to give up on themselves. I've had so many conversations about where I was and where I'm at today, and just being able to relate with them and give them some courage and hope just to keep pushing through, to keep striving to become better, to do more.
Don't just accept your life as this is just the way it is. Just keep going.
For patients who find themselves in that situation with refractory severe pain, they haven't gotten improvement, that's a huge motivator for us to try to work on research to develop better therapies, to do the clinical trials. And for those patients, I would say, to stay engaged with us on that. We're always looking for better therapies for intractable chronic low back pain. And there's a tremendous amount of research, both in terms of improving things like stimulators, looking for medications that would be more effective, regenerative therapies that could help to regenerate damaged discs. But there is incremental progress that's happening. And there's a lot of interest in improving imaging studies that might perhaps give us a stronger indication of what is causing the pain. Those of us who work in this field are really striving to keep developing better and better therapies that are going to get great outcomes for more and more patients.
I'm very hopeful for the future. There's just things that I want to be able to experience and before I would have never been able to. So looking forward, there's a lot of big goals, a lot of big dreams, and I've got a lot of work to do to get there.